A bowel obstruction stops the bolus and other digestive contents from reaching the part of the intestine beyond the blockage. The lack of peristalsis that occurs during a bowel obstruction can cause the large intestine to twist upon itself, cutting off circulation and causing tissue death. The area of the intestine experiencing tissue death may require surgical removal. Sometimes the remaining parts of the healthy intestine can be reattached to regain normal bowel function. However, if reattachment is not possible, an opening called a stoma is surgically created in the abdominal wall where the healthy part of the intestine is attached. The type of surgery to create a stoma in the colon is referred to as a colostomy. Fecal matter is collected in a drainage bag that attaches to the stoma via a device commonly called a wafer. In this manner, elimination occurs through the stoma into a pouch rather than through the rectum. Bowel obstructions, as well as other gastrointestinal conditions, such as colon cancer, severe infection, fistulas, or colon injuries, can lead to the placement of a stoma. See the image above of a stoma. See the image above of the wafer to which the drainage bag attaches. See the image above of an attached drainage bag. The most effective interventions for improving digestive function are to encourage intake of fiber, water, and other fluids, as well as promoting activity as tolerated. Fiber adds bulk to the bolus to keep it moving through the large intestine. Fiber is found in plants, so any food that originates from growing in the ground contains fiber. Examples of high-fiber foods include grains in bread and cereal, rice, barley, quinoa, fruits, and vegetables. Whole grains are preferred because they contain more fiber than processed grains. Water and other fluids aid in peristaltic movement, and activity increases circulation to improve digestive function. This slide and the following 4 outline common digestive system diagnoses and specific nursing assistant interventions. Hemorrhoids. Definition: swollen veins in the rectum and anus caused by straining from constipation, during childbirth, or from regular heavy lifting. Risk increases with aging. Symptoms to report: bleeding during bowel movements should be reported to the nurse for follow-up. If a hemorrhoid becomes strangulated or a clot forms in a hemorrhoid, it can cause severe pain, swelling, inflammation, or a hard lump near the anus and should be immediately reported. Specific interventions: apply topical hemorrhoid cream to reduce pain as ordered. Gently cleanse anal area. Discourage sitting for long periods of time, especially on the toilet. Encourage use of the bathroom as soon as the urge is felt to have a bowel movement. Seek emergency assistance for large amounts of rectal bleeding or associated lightheadedness, dizziness, or faintness. Irritable bowel syndrome, IBS. Definition: a chronic disorder causing cramping, abdominal pain, bloating, gas, diarrhea, and constipation. Symptoms may be triggered by stress or specific foods. Symptoms to report: increased symptoms. Specific interventions: avoid foods that trigger an individual's symptoms. Avoid gas-producing foods like broccoli and cauliflower. Report a change in bowel habits or rectal bleeding to the nurse. Gastroesophageal reflux disease, GERD. Definition: stomach acid flows back into the esophagus, causing symptoms often referred to as heartburn. Symptoms to report: burning sensation in chest, regurgitation of food or sour liquid, or chronic cough. Specific interventions: avoid eating large meals or eating late at night. Avoid foods that trigger symptoms such as fatty or fried foods, tomato sauce, alcohol, chocolate, mint, garlic, onion, and caffeine. Avoid beverages that trigger symptoms, such as alcohol or coffee. Encourage quitting smoking. Discourage lying down after a meal. Elevate the head of the bed 6 to 9 inches. Avoid wearing tight-fitting clothing that puts pressure on the abdomen. Food intolerance. Definition: an inability to digest specific foods. Common food intolerances are lactose intolerance, dairy, or gluten intolerance. Wheat. Symptoms to report: increased gas, bloating, diarrhea, and abdominal cramping. Specific interventions: avoid trigger foods. For lactose intolerance, lactose-reduced dairy products may be eaten, or a lactase enzyme may be added to milk to break down the lactose. For gluten intolerance, oat, rice, or corn products may be substituted for wheat. Food allergies. Definition: an immune system reaction to a specific food that can range from mild to life-threatening. Symptoms to report: immediately report hives, a new rash, swelling of the lips, tongue or throat, or problems breathing. Specific interventions: check the client's dietary orders before serving meal trays and ensure correct foods are provided. Common food allergies include shellfish, peanuts, and eggs. Severe food allergies can cause anaphylaxis, a life-threatening reaction that blocks breathing and requires emergency assistance.